one of the things that we learned in the Cresta Fatigue Clinic, where we work with people with chronic pain and chronic fatigue for the last 10 years, is that having chronic physical symptoms is hard work. And part of that work is you're constantly having to explain yourself. So casually, people walking through the door, they look well. And that is not necessarily a good thing, because if you look well to your partner, to your medical professional, to the person who's assessing you for benefits, you're going to have to come up with a story. People who have chronic illness, they need to be storytellers. They need to explain what's going on with them. It's part of the work of being ill. You see it in cancer, you see it in diabetes, but what makes it a particularly cruel burden in people with chronic pain is this mismatch between how they look and how they actually feel, and the fact that no one around them really gets it, including us, including the health professionals, including the public. So that's a really difficult burden to be landed with. And one of the things people consistently told us over the 10 years of the clinic was, you believed us. You recognized the reality of our symptoms. So when we came up with a training intervention for GPs, which we called the real intervention, the intervention was called that because of its 4 parts. The first part of which was to recognize the lived reality of the symptoms. So yeah, that's where we started. We listened to the story of what was going on with people. The second part of that intervention, the second part of what we were routinely helping people do in the clinic, was understand the symptoms, because you can't explain them to someone else if you don't explain them for yourself. And again, that's one of the questions that's come up for you folks, is what does it look like to have a plausible explanation for chronic pain? Without going into too much biological detail, one of the things that we know from health psychology and from the biology of pain and other symptoms is stuff that happens to you, stress in life, trauma. It's not just something that happens in your head, it happens to your body. It changes the way your immune system works, it changes the way your nervous system works, changes the way your brain and body communicate, and it changes the way all of those things work together. And you tend to see these symptoms developing in people who have been pushed to the limits of themselves, where too much has been going on for too long. Bodies, hearts, and minds that are at capacity or past capacity. And in the moment, you only know what you feel because your body and your brain are in constant dialogue. That's how you know you're tired. It's how you know you're hungry. So that dialogue's going on all the time, mostly subconsciously. But we're beginning to understand that that's where pain emerges. It's in that dialogue between your brain and your body. So it's absolutely embodied. It's absolutely real, the pain that's experienced in chronic pain, because your body is saying there is danger, there is damage, there is something wrong, and it's bringing it constantly to your constant attention. And one of the things that an explanation for your pain in terms of those mechanisms can help you do is to put it to one side. So it's really difficult to work on managing your pain, to getting on with your life, if you don't know why you've got it, or if you're having to prove to other people that you're ill. So once we work with people to have an understanding of what was causing and maintaining their pain, we would then go on to helping them act with their pain, to expand their world again, so it wasn't all about the pain, to experience joy and connection again, which are often being drained by the pain, and also to be able to genuinely rest and recover, to switch off and look after themselves. So that was the shape of our intervention. We recognize the symptoms, we help people explain it, we help them act with or in spite of the pain. And together, we learned how they could best manage their pain. But I think the key thing is the pain is real.